share my screen. Thank you very much. Let's get started. Welcome everybody. Good morning, afternoon. It's midnight here in Washington D.C. Greetings from the United States. I'm Brian Morales. I'm the chief of the Counter-Narcotics Branch in the U.S. Department of State's Bureau of International Narcotics and Law Enforcement Affairs. It's a pleasure to join you here for the first sub-working group meeting of sub-working group 2.1, which is data collection, analysis, and trends, including early warning. I am going to provide some administrative announcements, and then we will get started with our session today. So this is the third of a 4-hour block of meetings. We had earlier the manufacturing and trafficking meetings, and we will have one more session after this on detecting emerging threats and patterns for sub-working group 2.2. And tomorrow we will have 3 sub-working group sessions related to public health. This is the East group meeting. We had the West group meetings last week, and so this is the second, but the presentations have been mostly the same between both sub-working groups in both regions. I want to highlight our email address at the bottom of the screen, syntheticscoalition@state.gov. Should you have any questions, ideas, issues, concerns, please reach out to us. It would be great to hear from you and see how we can make your work during this year with the coalition most productive. I want to also share that registration for the working groups and sub-working groups of the coalition will remain open for the duration of the year of the coalition through September of next year. If you need these links, again, we're happy to send them to you through the email address below. Also, I wanted to share that there is a new website for the coalition that we are currently developing, and the presentations from today will be posted on there. We started recording already, but I want to importantly share with you that we will stop the recording every month when we have these sessions. We'll stop the recording after the presentations. So the comments period will not be recorded. So you should feel free to make your interventions, and be as candid as you can be for those portions of the sessions. I also want to share that international organizations have identified coordinators who have volunteered to support the sub-working groups, and they will prepare a meeting summary in terms of the results and conclusions. We will compile all of that and we'll put that on the website so that you will all have the minutes of the meetings. I'll also share that in the next few weeks, the Secretariat will be sending a schedule of all of the meetings for the entire year, so you know when the meetings are going to take place. They will always take place at the same scheduled time, so at this time, on the date in the future when you see the schedule is when we'll have this sub-working group meet once again. And we will also be sending, in any case, calendar invites through Outlook so that you have the next few months, you have the meeting reserved on your calendar for the next few months. And we'll be doing that over the coming few weeks, so you have those. Finally, I want to share with you that we have 2 sub-working groups where we do not currently have co-chairs, the 1.1 on manufacturing and trafficking, and then also this sub-working group, 2.1 on data collection, analysis, and trends. If you are interested in serving as the co-chair for this sub-working group, please send us an email, again at syntheticscoalition@state.gov. We would love to hear from you. We'd love for your participation as co-chair of the sub-working group. We have 2 positions or 2 slots for 2 co-chairs. So we would encourage you to consider that if you are able to do that. And now I want to end by sharing the meeting schedule for the next year. This session is going to focus on framing the issue, discussing what are the major challenges that we see in terms of this topic that we are discussing today. Then we have between November and February, importantly, an opportunity to look at what opportunities exist to share best practices, to share models, to look at what the global architecture or ecosystem looks like in terms of opportunities for intervention points. And then we want to highlight what these deliverables and commitments would be. So this is a very key time for the coalition's work. In March, we will have the sub-working group co-chairs report to the working group co-chairs in terms of the progress that the sub-working groups are making. And then between April and July, we will be focused on action planning and implementation. And that is where we really start operationalizing the work that we have, that we're discussing. Then we will start looking at how do we evaluate our work and how do we start transitioning to ensure there's sustainability following the end of the coalition, because in September we'll have the final coalition working group meeting, again sub-working group co-chairs reporting to the working group co-chairs, and that will be the end of the coalition's work. However, each individual initiative or project that may be an ongoing initiative that currently exists or a new initiative that we begin, they will all continue to live on through other organizations or other processes for years to come. So we hope that we will actually be stimulating and then sort of kicking off initiatives and new initiatives in some cases, and then having that work continue well into the future as an action item, as a deliverable. So that is a bit of the meeting schedule. I'm going to stop sharing my screen now. And I'm going now to introduce our International Organization Coordinator for this session, followed by our Provisional Chair, who is stepping in to support us today. So for the International Organization Coordinator, we have Inshik Sim, Program Manager at the UNODC Regional Office for Southeast Asia and the Pacific. And then, let me pause there so he can introduce himself.
Thank you very much, Brian. You are serving for this coalition at midnight there. This is amazing. My name is Inshik Shim. I'm very pleased to serve as the International Organization Coordinator for this particular working group 2.1 and also 2.2 later. I'm served at UNODC as the Regional Coordinator for Center Director of Matters for East Asia, Southeast Asia, and the Pacific, also supporting the implementation of a precursor-related activities in the region as well. Thank you very much for this opportunity to serve as an International Organization Coordinator. Thank you.
Thank you so much, Inshik. And then we have William Solly, the INL Director from U.S. Embassy Vientiane in Laos, who is serving as our provisional chair. So I'll turn it over to him. Thank you so much.
Thank you so much, Brian. It's wonderful to be here, colleagues. As Brian indicated, my name is William Solly, or Bill. I am the INL Director in Embassy Vientiane, where we're certainly trying to engage on many of, if not all, of these issues. I look forward to the presentation that we're going to receive and a robust discussion afterward. And would just like to ask colleagues on the call to please, consider what you're doing on these topics and be ready to share at the conclusion of the presentation. I think that this is a really incredible initiative, but the value really comes from your participation and from hearing from you, your successes in your context and your challenges. So I look forward to that discussion. But in the meantime, I think I would like to turn to our presentation, which Brian, correct me if I'm wrong, will be delivered by Ms. Angela May, Chief of Research and Trends Analysis Branch at UNODC. Thank you.
Hello, my name is Angela May. I'm the head of the UNODC research here in Vienna. And I would like to start this conversation on the global landscape and challenges in the data collection, analysis, and trends, including early warning. In my introduction, I wanted to cover first what is the ideal system that we need in order to fully understand the drug issues, and then going into the challenge and conclude with maybe some positive remarks on some improvements that we see at the global level. So I will start by saying, what is the information that we need? Basically, we can classify this information need into 3 areas. So to first understand the size and patterns of a synthetic drug phenomenon, then to understand the harm of the synthetic drug phenomenon, and also to look at the response of the synthetic drug phenomenon and its harm. And this is across the demand side, the supply, what we call the markets, health, criminal justice. And we need the information to describe the problem, but also to predict the threat that we see in terms of drugs, both at national, regional, and global level. And also we need the information to understand the impact that drug policy have at all levels. So if we start by, trigger it down and see what is the information needs for on the demand side, and again looking at the size, the harm, and the responses, and you see that the information is quite rich of the kind of indicators that we need, from understanding the size, to understand how many, who, what substances, and how drugs are used in different settings, for example, including new psychoactive substances, but also understanding the harm in terms of health, and to understand also the responses to the drug use, in terms of looking at availability of treatment services, delivery, accessibility. So there is a wide range of indicators information needed. Also the same for the supply, and you see here again a wide range of indicators needed to have a full picture, from understanding the size, so in terms of production, trafficking, emerging of new psychoactive substances, the profiling of drugs, but also how the drugs are distributed, how the trafficking flows, who is involved, what are the actors, the criminal organizations around production and trafficking. And also to see, important to understand the harm that production and trafficking done to the society in terms of violence or challenges in security and safety, but also in terms of environmental harm or economic harm in terms of money laundering. Overall, the harm that drug trafficking can pose actually to the whole challenging the whole rule of law. But also to look at the responses in terms of the control, the way how law enforcement addresses the criminal justice system, and also how, for example, the cultivation of drug is addressed in terms of alternative development, eradication. So again, the need for this wide range of information, data, and indicators. But alone, these indicators can tell us maybe just a piece of information, but where the value of really understanding the drug phenomenon is in putting together information that comes across demand, supply. And here is just an example on how we often think about the drug issue in terms of markets. So where the dynamic of the demand and the supply meets, and understanding better demand and supply helps to see how these two dimensions interact. And so an indicator like seizures that alone cannot really say a lot in terms of meaning, in terms of increase or decrease of a drug problem, because seizures is an indicator that can show change in supply, but also change in law enforcement capacity. And alone, if we see an increase or decrease of seizure, can say very little whether this is an increase in the market or decrease of the market. But when seizures are analyzed together with, for example, consumption, purity, price, that's where we understand whether the market is shrinking or is contracting. So, for example, an increase in seizure together with an increase in purity and a decrease of price is clearly a signal of an expansion of the market. But the same increase in seizures together with lower purity and with higher price is actually an indication of contraction. So the importance of looking at it together to really understand not only what is happening currently, but also thinking about the threat in the future. And on the right side, you see a graph that is done for cocaine, not the synthetic drugs, but still is to make the point on how these indicators can tell the story. And you see here the bars that are the seizures, the pink colors is consumption, and the green is wholesale purity. You see that for example, when the market was changed, the seizures were quite stable. But then looking at the increase of purity and the increase of consumption, clearly it was easy to really understand when it was happening, the change in the market, and also understand how, to read, how to read the increase in the seizures. So this is just as an example. Another point is that to say how unconnected events can be really analyzed together to understand pattern and flows. And this is again, for example, the example of seizures. And here you see when we connect in a way all the dots that we see, not only at the national level, but also at regional and also transnational, transregional level, clearly see how when we connect the dots, we can understand the transnational flows. Here is an example of a map of methamphetamine flows in Southeast Asia. And the example that you see on the right, again, is another example on how, for example, to use, again, information on individual seizures and information on the nationality of the traffickers arrested, how, and this is, you can see from the left side is the level of the seizure, so retail level on the left, and going to the right is more larger seizure, so toward the wholesale. You see how the groups change, and you see that how some certain groups are more involved at retail level, and other groups of different nationalities are involved at the wholesale level. Again, these are just examples, and this is an example from Europe, again, about cocaine. But just example of how unconnected events like individual seizures, when brought together across countries, can really help to make the picture, to understand better the phenomenon. And if we wanted to have that kind of comprehensive information, as I described earlier, what is needed is also a comprehensive set of data sources. And what you see here is a collage of the all different sources that are needed. From the health side, mainly administrative records of health facilities, even like hospital, but also treatment centers, and also particularly drug use survey, so population-based drug use survey, the golden standard of the source in terms of understanding the size of the drug use, and also who use mostly drugs, and also on the size of the supply is mostly administrative records of law enforcement, of criminal justice institution. But what I also wanted to emphasize are very non-traditional, if you want, sources for the drug sphere. And so you see there in the pink, for example, private sector, banks, internet and social media records, but also trade and and production of out of the chemical industry. These are all elements that are particularly important for synthetic drugs, and not only for synthetic drugs but for drugs in general, because today we see all over expanding more and more in the world where drugs are not traded in the street anymore, but more really through social media and encrypted messages. But it's also to notice data sources like wastewater analysis that are very cost-effective way of understanding consumption, maybe not use per se, but consumption of drugs, early warning system, but also the role of the laboratories, the forensic and toxicology laboratories, and also the role of financial intelligence units to really understand particularly the money laundering and the profit and what happened with the profit made with drugs. And But what is important in this source is not just the idea of having, ideally, in each country, the combination of all of these sources, but to ensure that the sources are comprehensive. And so, for example, often, treatment records focus only or cover only public institutions. And in countries where most of the drug treatment is delivered through private, for example, they are not often included in national treatment, data treatment systems. But also the idea that the resources are comparable and that they can be linked. Because as I said earlier, the importance of seeing the linkage across these different data sources, and the importance of these sources to be able to collect and retain disaggregated data, not only by sex, but also by subpopulation groups that are particularly vulnerable on the drug problem. But also, again, to have data accessibility, so to make sure that the sources are used at the maximum of the capacity that they have in terms of data. So the importance of having also policy for data accessibility across all of the sources. And ultimately, really making sure that there is also an analytical capacity to bring it all together. So this is the ideal world where we could have all of the sources analyzed and brought together. But the reality, and here I wanted to, look at actually from what we would like to have on what we actually have currently. And you see here what we have put together from our the global data collection system, the annual report questionnaire. And these are the percentages that you see for different years. The different colors represent 2021 and 2022. And see how the countries report information. And this is what you see is the percentage of countries that reported to UNODC the different indicators. And you see that the supply indicators, in a way, have the golden indicator, that is the seizures, that is available across basically all countries. But when even for the supply, the information is more refined, like for example prices, you see how that from almost 100% we have about 80% of countries that are able to report on prices, and even much less when we look at the clandestine laboratories, and see how the percentage of countries that can report on this is much small. And for the demand indicator, there is not that golden indicator like the seizures that is available across all countries. As I was saying earlier, the golden standard indicator for demand is the annual prevalence that is collected mainly through population survey. And you see here that no more than about 40% of countries are able to report on prevalence. And so really the understanding of the magnitude of drug use across the world is really remain very limited, particularly because in these percentages there are also large countries with large population where we don't have annual prevalence data. But you see that even for looking at, for example, drug-related deaths, no more than half of the countries can provide. And the same, for people in treatment is a little bit more, but still no more than about 60%. And again, the percentages varies also for the criminal justice indicators. But it is not only important to have one indicator reported as such, but also to look at the disaggregation of the data that each indicator can provide. And again, you see here the different percentages of countries that are able to disaggregate their data by sex. And here you see the reported total is the black, and the green is the percentage of those indicators that can be disaggregated by sex. And you see again that while we are close to almost all indicators, all countries being able to report this indicator by sex, there is still a difference, and so there are still issues in relation to disaggregating data by sex. So the same you can see here for both from demand indicator and criminal justice indicators. But here is a zoom in the Asian Pacific region, again, to look at sex disaggregated data reported to UNODC. And you see here a difference between the old annual report questionnaire, so the old system that we use to collect information, and the new system. And you see here the darker color is the number of data series where that are sex disaggregated, and the light is where they are not. And you see here again the improvement, so that to me it shows that the way how data are collected makes a difference in increasing the reporting disaggregated by sex. But it also shows that there are still considerable number of data series that cannot be disaggregated by sex. And where are the challenges? So why these indicators, the percentage are so low? And this challenges various, and they are, some issues are very general. Some relates to the public, to the political will to actually invest on data collection on drugs. So the political will to see that an investment on data collection on drugs can really bring value in addressing better the problem, but also technical capacity. And there is overall a lack of georeference and event-based data. Also in the criminal justice system, there is a lot of awareness and understanding now of how much more value data that are event-based rather than aggregated can make a really difference in understanding the problem. The graphs that I showed you earlier, based on individual seizures, shows the kind of analysis and granular analysis that we can do when the data is event-based and not just aggregated. But there is also an overall lack of coordination in bringing all of these sources together, really to bring the maximum that can be extracted, even from the little information that is available. And there are also many countries, I would say, in the data sphere, almost a lack of awareness on the need to develop data governance policies. Data governance that really can help to define on how the different data sources can be accessed by different institutions, by different audiences, but also how to increase the use of the data while also respecting confidentiality, while also in a way protecting the data for their misuse. But out of this kind of generic challenges, there are definitely specific challenges relating to demand type of data and supply type of data. You see here, and you can read examples of these challenges, but clearly for the demand, one of the challenges is really to understand the drug use, and the big challenge that there are in countries where drug use is stigma, and so the difficulties of self-reporting drug use, and so to have information even based on surveys that where there is not a huge under-reporting of drug use because of this stigma, and so the need for new methodology to really overcome, for example, this underestimation of drug use. But there are again a range of other challenges that we can see also in the lack of, as I was saying earlier, technical expertise in analysis, and also from the supply side, also a lack of analysis of the impact that, for example, law enforcement may have on the overall market, as just an example of one of the challenges. But let me focus maybe on one type of information and source to describe these challenges, and talking about national early warning system. And clearly, one of the challenges relating to this national system is that they have to be based on evidence, and so on solid data. And how to build this solidity in data that are typically reported by laboratories, but also by health facility like hospital, emergency services. And so how to build the responsibility of this data quality in systems that are not primarily designed for data collection. But there is also an issue of sensitivity of data, because some of this data is collected for criminal justice purposes, and so maybe on cases that are still ongoing. And so, as I was saying earlier, the lack of data governance approaches and clear policy also undermine and prevent some of the full use of this data, because there are not clear rules on the engagement of different institutions in terms of maintaining confidentiality while using the data. But overall is also how to build data system in systems that have not been designed, as I said earlier, for data collection itself. And so often data are not stored properly, are not really brought together in a comprehensive way, because those that maintain this kind of information have a different primary purpose. But so this is an example of a data source that requires investment, but can give in return a lot of information that can actually really help to target better the policies. But, talking about also challenges is also the way at what level these challenges emerge. And clearly they emerge at all levels, from the local level to the national and to the regional and global level. So at the local level, it's where the data is generated, because either it is a treatment center, or is it an operation of law enforcement. That's where, so if it's not properly registered, if it's not properly recorded, can never go through the system, national and global. And so the challenge at the local level is mainly very often low level of digitalization. And also unequal level of digitalization in different local areas. In some region of the country can have a very high tech system, and in another region of the same country can still have a manual recording. But also that's where the lack of geo-reference happens. If it's not built at the local level, it can never go at a higher level. And so often these systems are not geo-located, and this is particularly important, for example, for the supply, looking at the drug supply. But also at national level, one of the really big challenges that there is the lack of coordination. So to have a single institution that can bring together all the data sources together. And often in other regions, like for example in Latin America, there is a culture of national observatories. This is less so in Asia, and so that's where the challenge is how to bring together and to make sure that there is one place that can really analyze the drug issue together. And then there is the challenge at global level, that is an issue of comparability. So the issue of having a common taxonomy of, for example, of synthetic drugs. We see often when countries report at the global level that they might have difficulties in distinguishing different synthetic drugs compared, for example, to more plant-based and traditional drugs. But there are also challenges, not only at each level, but also in transmitting the information from one level to the next. So, for example, if there is a very weak national coordination system and standardization system, clearly the information from local level to national level is challenged. And the same at bringing the information from national level to international level. If there is not a national coordination system, then what comes at the international level is not comprehensive, is not coherent even within a country. So I wanted to conclude by basically saying a positive note, and showing that actually information can be improved. And this is, I take it from our level, from the global level, on showing the reporting of data through the annual report questionnaire. And you see that for 2021 data, we had 125 countries that submitted the data. And you see there in the red bars, the increase that we had for the 2021 data. Currently, we are collecting 2022 data, so I'm talking about what we collected, in a way, the completed data collection for 2021 data. And so you see clearly in the map where primarily the gaps are, but the increase that we see in the number of countries is particularly in some part of Africa, where we invested in working with appointed national focal points to really work and bringing again the level information at national level, bringing different people from the same countries in the same table, and really showing that how they can put together all the data from a country. And here is show particularly the picture for Asia and the Pacific. And you see here actually that for this region there has not been a lot of progress. But as I said, what we have done in Africa, in a way, is an example of how actually we can improve, and relatively fast. And you see here that have not changed the number of countries, more or less, that have submitted data to UNODC. And here you see, in 2022, the 37 countries submitted and 42 countries didn't submit. Among the non-submitted countries where we really have a very large gaps are in the Pacific Islands, where, in the Pacific, we basically have only Australia and New Zealand that are able to report at the global level. So with this, I leave you to the discussion, and I'm looking forward to hear on how together we can construct and help together to come up with a clear understanding at transnational level of the drug issue, because it's only when we bring together all of the countries together is that we can understand the magnitude of the problem, and particularly its transnational nature. So, thank you.